Good morning. Today is Thursday, January the 21st, and this is our weekly COVID-19 update briefing. As of today in Bossier Parish, unfortunately, we've had a large increase in positive cases, an increase of 458 this past week, bringing our total today to 10,826. And unfortunately, we've had an increase of 21 deaths. That's the highest increase in 1 week since we've been monitoring this, and brings our total deaths in the parish now to 224. All 64 parishes in Louisiana continue the community spread of the virus. This is a major concern. The governor recently stated that the number of cases is at an all-time high and that we haven't peaked yet. It's going to get worse, he said. On January the 12th, the governor directed that the state would remain in the modified phase 2 for another 28 days, which would run from January 13th through the 10th of February. It's been reported that 2/3 of the United States are experiencing a rising surge in the virus, and now, 1 year later, after the first case of the virus, the deaths in the United States has exceeded 400,000, staggering figure. Also, there's a known variant to COVID-19 that started in England, or was first noticed in England, but it is now in the States and it is now in Louisiana. The good news is medical experts say that the existing vaccines are effective against this new variant, but the bad news is that the CDC has indicated it is about 50% more contagious than the original virus. This will result in more people getting the virus and result, unfortunately, in more patient hospitalizations and, regrettably, more deaths. Hospitals have indicated that the latest trajectory of cases, if continued unabated, will overwhelm their facilities. Many hospitals are at or near that point. This new variant is impacting our capacity to deliver effective and timely health care. The governor has recently stated that, and I quote, "Should there be an increase in the number of confirmed positive COVID-19 cases or the percent of positivity of testing, or should the number of COVID-19 related hospitalizations threaten the ability of our healthcare system to properly respond, it may be necessary to go back to the full restrictions in the stay-at-home order." He's obviously reluctant to do that, but it is just a possibility. The governor has conceded that the strict statewide enforcement of his directives is simply not feasible. There's just not enough bodies to go around and police all the facilities that may be violating this directive, but he just urges that we be good neighbors and voluntarily and consistently comply with the prevention and mitigation protocols. The vaccinations have begun in the local area, but regrettably, there have been serious problems in the distributing and administration of the number of vaccinations that had been projected for the end of December last year. So the Louisiana Department of Health has now refined the priority for individuals to receive the vaccine, which is currently as follows. First, phase 1A, there's 3 categories, and that's people: 1, in hospital personnel; 2, nursing home and long-term care facility residents and staff; and then number 3, first responders to serve as vaccinators, EMS and fire, police, for example. They might have to ask for some of those folks to help give the shots. In phase 1B, tier 1, there are 9 categories that the Department of Health have listed. They are as follows: person age 70 and older, outpatient clinic providers and staff, urgent care clinics and staff, community care clinics providers and staff, behavioral health clinic providers and staff, dialysis providers and recipients, home health service providers, direct support workers, and recipients. Number 8, the dental providers and staff, and lastly, schools of allied health students, residents, and staff. Vaccinations for the general populations are still projected to be in the May-June timeframe of this year. It has been said that eventually the pharmacists, clinics, and other locations in all 64 parishes have or will receive some of the quantity of vaccines. However, you should be reminded they will only give the vaccinations by appointment, so make sure you get an appointment before you go into one of these facilities to try to receive the vaccination. There is some evidence that more people are receptive to take the vaccinations than originally. However, some people have legitimate medical and religious reasons to refuse the vaccination, and others have refused it for a variety of reasons. It's been reported that it takes about 75 to 80% of the eligible populace being vaccinated to achieve herd immunity. If a significant number of people refuse the vaccination, we may not achieve herd immunity, and the effectiveness of the vaccine will be minimized if large numbers refuse the vaccination. As we have heard many times, the number of people who are asymptomatic is estimated to be about 50%. They do not develop nor show the symptoms, but they have the virus with them, and they can transmit it without their knowledge to other people, causing illness and, unfortunately, in some cases, death. The governor has ordered, and I quote, that the mask remains a major issue of concern, and the governor has directed that every individual in Louisiana age 8 or older shall wear a face covering the mouth and the nose when inside a commercial establishment or any other building or space open to the public, whether indoors or outdoors, and this includes public or commercial modes of transportation. Also, the CDC is now recommending that children aged 2 to 7 wear the mask also. The governor recently pointed out that the number of vaccines now approved and others in the pipeline is showing that there's light at the end of the tunnel of this pandemic. However, what is needed now in the near term is we've got to comply with the prevention and mitigation protocols to get us through this tunnel with minimum loss of lives and the impact on their citizens and our national economy. The Center for Disease Control and Louisiana Department of Health have determined that the number of days a person should remain in quarantine can be shortened to 10 days on day 11 when no symptoms have been reported during the daily monitoring period. And also, quarantine can be reduced to 7 days on day 8 if the individual takes the COVID-19 test and receives a negative result. The Center for Disease Control hopes these shorter quarantine periods will encourage more people to receive the vaccination. The Louisiana Department of Health, however, still recommends the 14-day quarantine period for people, residents and staff of congregate living facilities, such things as nursing homes, and correctional facilities. The state's most recent number of positive cases is still high. It is now at about 14.5%, which is about 3 times higher than the goal of 5% or less. This should be a major concern to all of us. And if we don't comply with the recommended prevention and mitigation procedures, we're going to continue to have a growing number of cases, illnesses, and deaths. And the prevention and mitigation protocols remain unchanged, and I will summarize those again as we do each week. First and foremost, wear a mask. Wash your hands. Social distance at least 6 feet or more. Do not touch your face. Disinfect surfaces which are frequently touched, such things as computers, doorknobs, handrails, those sorts of things. Cough into the bend of your elbow. If you're sick, stay at home and follow the advice of your medical provider. And as always, avoid crowds. And the Center for Disease and Control and the governor still urge people to get the flu shot if they haven't already done so, to help prevent compounding the problem of having the flu season, which is on us at this time, and the pandemic going on at the same time. Governor Edwards is pleading that we all comply with the prevention and mitigation protocols. He has said that, and I quote, "Even with the vaccines available, controlling our behavior with the measures that are proven to help keep us safe is our best defense against spreading this virus to our family, to our friends, and throughout the communities. Thank you for your continuing participation in our joint fight against this deadly pandemic, especially at this critical time when the number of positive test results are exceptionally high. Our nation's ability to provide needed health care is in jeopardy." This shall conclude today's briefing. Our next scheduled briefing will be Thursday, January 28th. Thank you and good day.